Hi folks, this is Sario for CBNR. Today we are going to talk about biases and how it stops from shifting from one paradigm to another. Now, to start with, I will just look into a simple terminology. What's a paradigm? A paradigm is sort of a model or a group of ideas stitched together. And Thomas Kuhn famously said that science grows as the paradigm shifts, right, from one idea to another. Now, most of our paradigm in case of physiotherapy is that a single etiology, or it's mostly in medicine, single etiology leads to a particular disease or disability. It is not just in case of ONE where we think that wear and tear leads to disability or ONE pain, right? Or changes in the spinal joints, whether it is the zygophysial joints or the disc, it leads to back pain, or it is a spasticity leads to disability, right? So all of our ideas of medicine is based on this. That is, tuberculosis is caused by a particular germ and causes tuberculosis. Right. So this is the way we are taught. This is where we think. This is our paradigm. Now, as I told you, the paradigm is fairly linear. A leads to B. Right. Now, if you are thinking about this way, we have to answer a lot of questions which may not fit into this particular category. Say, for example, then if it is wear and tear to people who sit for a long time or always taking rest, do they fare better, or their knees protected, if you will? Will walking make it worse? Do exercise make it worse? The bigger the X-ray changes, does it make our joint more disabled or the symptoms more worse, right? Likewise, in case of stroke or cerebral palsy, we know that we think that spasticity is the reason for everything. Um, Reduction of spasticity leads to all sorts of improvement, and less disability is because you have less spasticity. Um, but if you if you if you look at it more keenly, you will observe that spasticity alone cannot explain everything in case of human lesions. Now that led to our understanding from that the system of biology is not a simple system, it is a complex system, and it is influenced by psychosocial factors also. Now this way of thinking started in the 60s, got bigger and bigger in the 80s and the 90s. Uh, you will see this in case of spasticity, where we used to think that A causes B. That was what Bobat and other pioneers were talking for a long time. But when it came in the 90s and 90s, especially in the early 90s and late 90s, if you will, people started questioning it. People started throwing factors like weakness, sort of biological factors, and contractures rather than just a spasticity. The other psychosocial factors were also sort of put on, right? If you live in a close quarters, small home, you have less chances of moving, so you may be more disabled. Likewise, in ONE, it's not just the destruction of the joint alone leads to more disease or less disease or more disability. It's a complicated, many factors, right? That is because our system is a complex system. So we are more moved from A leads to B to sort of A to F to infinite leads to a disease rather than just a single factor. But these don't filter into our practice or even our curriculum. if you still go and say that spasticity is not a big problem in stroke, uh, you will probably fail. And if you say that you can do cycling or walking in ONE, they will just laugh at you, right? So I was trying to think why this is what are the reasons for that. And the COVID started, and I started hearing this name and started learning about a particular person, a doctor who told us probably 200 years back, uh, 200, 150 years back, to start washing our hands. This is before germ theory. He didn't know there are germs in our hands, but he understood. Igni says, Semmelweis, I don't know how to mm, exactly pronounce his name. Semmelweis was a sort of a not that great a physician, if you will, but he was an obstetrician, and he observed that there are two kinds of labor was happening. One was done by the midwives, another one was by the doctors, and he observed that the death rate when it was done by the doctors was higher, right? So he wanted to know why this was, and he had a lot of sort of observational studies, and at last he came to one particular thing. What he noticed was that when somebody died, the doctors did a dissection. That is, they took them to the mortuary and they did a dissection, and then they came back without properly cleaning their hands. So he said that probably you should clean your hands with chlorinated water. Uh, and that was the reason for this cross infection, and that lead to more death rate in when it is done by the doctors. But sadly, at that particular time, people started laughing at him, saying that they are all gentlemen, if you will. Uh, so their hands, they are clean people, and they didn't have an idea of germ also. So he was laughed out, and sadly, he died in an asylum going mad. Now, this was a simple paradigm shift from keeping your hands clean, and they didn't accept that, right? Now, he was uh, after that, there are a lot of other people came into play, Lister and things like that. They started getting into this so-called germ theory, and this was slowly accepted into our medical practice. What we call as a paradigm shift had happened. We have shifted from uh, we have shifted from uh, these are all because of that reason, the gases were there, the liquid was there, the pittam vayu and that kind of things. And this led to a huge paradigm shift and started heating things, cleaning things, sterilizing. All these things happened. There is paradigm shift happened. But as I told you, this shift happened slowly. Nobody was willing to accept that paradigm shift. And one of the reasons for that is what is called as a group of biases called as confirmation bias. Now, if somebody tells you that it is, if you wash your hands, it gets better, you just reflexively throw them away. That's what nowadays we call it as the Semmelweis reflex, right? Saying that you are wrong without looking into objectively into what they are saying, what is their data, and things like that, right? And we are also conservative, especially in India. We are a sort of a conservative society. We want to keep the culture, if you will, the belief, the great ancestral belief, right? So these set of confirmation beliefs stops us from moving from one paradigm to another paradigm. So I want to emphasize that if you have somebody comes and tells you something different or which you have not heard of, don't just reflexively throw away them. Find out whether there is an objective data for all these things which are given to you. And remember, you have a confirmation bias, so try to overcome that. I like to close this video by asking you two questions. What is the function of supraspinatus and what's the cause of peptic ulcers? What's the common cause for peptic ulcers? If you can find the right answer, that means that you have overcome your confirmation bias. Thank you so much. We will see you in another video. Bye bye.